Welcome everyone to the latest webinar for Burning Nights CRPS Support charity. And today is a great event. We've got a great informative event on Calmare Scrambler Therapy, named for complex regional pain syndrome, but I'm sure we're going to find out more. Today with us, we've got Dr. Michael Cooney, who I've known for almost 10 years now. Dr. Cooney is a doctor of chiropractic and very highly experienced pain management specialist with, I'm not going to say how many years experience, but decades of experience. And he's definitely a globally recognized Calmare Scrambler Therapy expert. So I believe it is over to you, Dr. Cooney.
Okay. Yeah, my experience now with Calmare goes back to 2011. I've been using it to treat complex regional pain syndrome patients on a regular basis. And it started with a patient back in 2011 who came to me in desperation with CRPS. And at that time, I was not familiar with the condition. At that time, actually, it was called RSD. And we treated her, and it was basically a learning curve. We had to try a number of different, what are called protocols or placements to achieve pain reduction. And it took us quite a while, but I'm happy to say that that was the impetus to put me forward into the CRPS realm. And her mom was very instrumental in getting on blog sites and support sites and putting out the information about the Calmare Scrambler. I've treated probably close to 2,000 patients right now since 2011. About 70% have been CRPS patients, RSD patients. The treatment itself is non-invasive. There are no side effects. It's basically what I believe, and anyone that says they know exactly what CRPS is, I think they're pulling at straws, because I've been doing this now for since 2011, as I said, and I have a great deal of confidence in what I think it could be. But it's not like CRPS is not like a condition with your heart or your lung, where you could open the chest and see that there's a valve bed or there's a cancer cell on a lung, and then treat it and close the person back up. CRPS is a brain malfunction. So what I believe is happening is there is a neurochemical issue with CRPS patients. I believe that there usually is an injury that starts off the pain. And for some reason, their bodies are not producing enough dopamine or serotonin or somatostatin. And when that occurs, they're not able to shut off the pain signal. Now, what we try and do through the Calmare Scrambler is we try and interrupt that pain loop within the brain and basically shut off or reboot the brain, so that we can allow the patient to slowly minimize the pain signal. Now, the reason that the treatment with Calmare is a 2-week protocol. It's Monday to Friday, Monday to Friday. They're treated for about an hour a day in the office. And the theory behind that is that what we're trying to do is retrain the brain. So I liken it to rote memory or muscle memory. You don't learn to ride a bike in one day. You don't learn your multiplication tables in one day. It's required that you do it over and over and over to train the brain. And that's what we're basically doing with the Calmare. We're sending a no pain signal to the brain through the C fibers of the nervous system to try and reduce that chronic loop that has developed within the brain itself. The presentation of CRPS varies tremendously. We use what's called the Budapest test. The Budapest test basically is saying or asking, obviously you're having unremitting pain in a particular area, and then there are about 12 associated symptoms. You could have color changes, everything from turning purple to blotching of the skin. You could have temperature changes. Someone may have increased temperatures. Some people are colder. Some people lose hair. Some people gain hair. So it's variable. But if they fulfill 4 or more of those associated symptoms with the Budapest test, then we're pretty sure that it's CRPS. What's important to note is that we have to determine for sure, and this is one of the reasons that I speak to every patient before they come in, is we have to make sure that we're treating a neuropathy and not a neuritis. The basic difference between the two is that a neuritis is something that is intermittent. So, for example, someone will wake up in the morning and they will be pain-free. But then when they start walking around and they're in gravity or they start sitting, then all of a sudden the lower back will start being painful, or the knee will start being painful. That's more of a neuritis. A neuropathy, as anyone knows with CRPS, is 24/7. You will have pain constantly. It may vary in intensity, but it will be there constantly. So that's why we have to kind of speak to every patient, to vet them, to make sure that we're dealing with a true neuropathy. I'm open to any questions at this point. If anybody, or if Nikki is available to answer questions about this great non-invasive, no side effects treatment.
Nikki, do you want to say something?
Sure. Just that, so my son and I have just come back actually from New Jersey after a very successful Calmare treatment. So obviously I'm overjoyed. Just kind of further to Dr. Cooney's intro there about, CRPS. So my son's a little bit different, but it has similarities. In 2021, he had actually trigeminal neuralgia, which is like nervous, it's nerve pain in the face, which he actually had an operation for. It was successfully treated, but it's an incredibly painful condition. And it was severe pain for 6 months. So from that, he recovered. Everything was wonderful until this December. Strangely enough, he was hit by a little bit of freezing rain when he was out doing chores, and he screamed. And as any good mother, I kind of laughed and said, "Don't be so over dramatic, get on with your chores." But from there, the pain just continued and continued. And, it was muscle spasms, allodynia. And the pain also started to increase and spread further than just his neck and shoulders. So eventually it started, before we got the treatment for him, started to go into his arms, hands, legs, and feet. So obviously this is a very, challenging thing. What is this? We're still actually waiting for a pain specialist here in Canada to review his case. But, with physiotherapists, with chiropractors, with acupuncture, with laser therapy, with osteopaths, and with a GP, it all kind of came to the point where, we decided that it was in fact sort of an amplified pain issue, similar to that of CRPS. So from there, I went into mum research mode. Started looking at amplified pain, started understanding a little bit more, and I came across, Dr. Cooney. And for us, Dr. Cooney isn't that far. So it's a 7-hour journey for us, which is a drive. So that's nice and close for Canadian standards. And we hopped in the car after I called and spoke with him and, went through his case, went through his facts. And Dr. Cooney thought it would be a really good fit. And so within 6 weeks, we packed up the car and we were heading south. And it was excellent. So from there, it was really nice. It was very informal. You had a nice sort of comforting perspective when you walked in. There was also Murphy the dog there every once in a while, much to my son's delight. Really fortunate that he responded in the first treatment. So after the first treatment, and during part of the treatment, he was pain-free. And then after the first treatment, he had 6 minutes of pain-free. So I got my first hug in about 3 to 4 months, which was wonderful in every way. And then he continued to progress. So he had started with a level 8 pain level, and then he eventually, by his 4th treatment, was down to a level 4 pain. And all of the areas where the pain had begun to spread, so not the central area where it originated, was all in remission. So we were at a level 0 for his arms and legs and feet and hands. So once we hit about the 4th treatment, I think he was about maybe at a half hour after treatment that he was pain-free. From there, we did hit a little bit of a stall. We managed to chip away sort of each session with the duration of time he was pain-free by a half hour here, a half hour there. But he wasn't moving the needle much in terms of the actual pain level. He still remained at a 4. So we kept going. I think we got at about, Dr. Cooney, if you remember, but I think we got at about 4.5 hours pain-free after the 10th treatment. And it was just one of those things. And Dr. Cooney was excellent. It's so wonderful what we had, but I wanted more. I was a bit greedy there. So we discussed it, and we decided to stay an extra 4 days. And I'm so pleased we did, because while maybe it's not the typical path, those extra 4 days sent him entirely in remission. So now I've been dropping him off at school every morning, which is spectacular for both him and I. And, he's managed to see his friends, and things are getting back on track. So I'm very grateful for that.
Thank you.
Questions.
Thank you, Nikki. It's great to hear your experience of Calmare as a parent as well. We have got a couple of questions, I believe. Lisa, have you got them? Please.
Yes, there's a couple of people who have asked, will the Calmare get rid of the allodynia?
Yes, absolutely. That's how I got my hug. So it's at least I'll let Dr. Cooney kind of field the more scientific type questions, but he's entirely pain-free. So not only is it the spasms, but it's also his sensitivity to touch.
Yes. No. Allodynia is a common side effect of the CRPS, and it does respond and go away. I think an example is what Nikki just said, and we've had the experience here a number of times with parents and children, in that they weren't able to hug them. And we talked earlier about the Davidsons, and of course Nikki just mentioned it, that she was able to hug him after 3 months. So the allodynia does go away. The whole idea, obviously, is to get rid of all of the associated symptoms that show up through the Budapest test. If you have skin color changes, we want that to go away. Changes, hair changes, temperature changes. There's a variety that are associated with the CRPS that we hope we can fully clear up and have the patient return to normal function.
We also have, how often would it need redoing after the first 10-day course?
The booster treatments are only predicated upon a return of symptoms. I don't treat prophylactically. Like, I don't tell patients come in once a month or once every 6 months or anything like that. My general response to it is that if you come in, for argument's sake, at a pain level of 7, and then we're lucky enough to get you down to a 0. If 6 months from now, a year from now, you start to feel that the pain is going, let's say, to a 2 or 3, I tell people to come in right away. And then it's only 2 or 3 booster treatments and you're done. Because what has happened is we've already started to retrain the brain. So we're hoping that the 2 to 3 booster treatments will reduce it to 0 again. And what I found, interestingly enough, is that with booster treatments, if a patient comes back after a year, they get the booster treatments, and generally they'll stay pain-free for a longer period of time. So, obviously, we hope that patients go into remission, but and in the most part, that is the case. But people do have to come back for booster treatments.
What's the time frame from first consultation to treatment starting?
Well, I do a basic consultation over the phone. I think I had mentioned earlier. I try and vet every patient. Then what I have the patient do is send me what we call our intake forms, our patient information forms, which describes everything that they have experienced. From that, I'm able to get a good fix on what I'm dealing with the patient. So when they do make an appointment, I've already discussed their case with them, and they come in, and then we finish doing a consultation, and we treat them the first day.
I believe we waited about 6 weeks from the time we spoke, Dr. Cooney, until my son's treatment.
Okay. Yeah, well, that had to do with my schedule, I think, more than anything else.
What's the lowest age that you would do Calmare therapy?
The youngest I've had was 8. The oldest I've had is 91. So that's the range, I guess.
A question for Nikki, please. Did your son ever tell you what it felt like, what the actual paddles or what the actual machinery, what it felt like?
Oh, I see. The treatment itself.
Yeah.
Well, yes. So I think different times in the process felt a little bit differently. But at one point, he was incredibly itchy, and Dr. Cooney's big mantra was, learn to love the itch because it's working, right? So he was quite itchy one time, and he was making me try and kind of scratch around about him as it's happening. But no, he didn't. He said it was actually quite calming for the most part. And then midway through, he would be pain-free. So he said he could also feel the pain levels decrease throughout the treatment as well. And it's actually quite funny too, because I used to feel like I could see in his eyes he'd kind of start to glaze a little bit. It was like he'd get quite tired, and you could see him relaxing.
Yeah, a couple of things on that. The only side effect that anybody ever talks about, number one, is fatigue. People will feel a little bit tired afterwards. And my suggestion always is if you feel that fatigue, take a nap, because the majority of healing occurs within the body. To try and develop that homeostasis within the body occurs during sleep. As far as what people feel during the treatment, it's important to understand that we do not want any discomfort. Obviously, with CRPS, if we create a pain signal, we're the CRPS. So we make a concerted effort to set the stimulation on the machine at a point that is comfortable, not in any way stimulating any pain signals going to the brain. So the whole idea is to calm. Actually, calmare is an Italian word meaning to calm. So as I didn't mention earlier, but this was developed in Italy. His initial attempt at utilizing the Calmare was geared to treat what's called chemotherapy-induced peripheral neuropathy. What happened is then we began to realize that we could treat CRPS and a variety of other types of neuropathies and in an effective way.
Actually, that does lead on to a couple of questions, I think, Lisa, would you agree, on diabetic neuropathy? So a couple of people in chat have said they've got diabetic neuropathy and peripheral neuropathy, as well as, in one case, CRPS. Do you think it would be suitable for them? They've got colour changes, temperature changes, ridge nails, as well as the diabetic neuropathy. Would it be suitable?
Okay. Then let me explain it this way. When there are two really different types of neuropathy. There are the types of neuropathy that have direct nerve damage. As I mentioned, CIPN, the chemotherapy-induced peripheral neuropathy. Those patients end up with neuropathy due to the heavy metals in the chemotherapy. Then you have the diabetic neuropathy patient who has damage to the nerves in the feet because of the lack of blood flow. Or you'll have a post-hepatic patient, which is a patient that has had shingles, and the virus itself has damaged the nerves. In those types of cases, the treatment is different in that we're treating the localized area, whereas with CRPS, we're trying to treat through what's called the dorsal horn of the spine, trying to communicate through the peripheral nerves to the central nervous system, obviously eventually to the brain to break the loop. So there are two different types of neuropathy that that require different approaches. But yes, the machine can help with diabetic or post-hepatic or some of these others. I mean, there's so many different diagnoses that people get from different places. We'll get people that really have CRPS, but they've been told they have amplified pain syndrome. So it really has to be determined, like I said, through a consultation so that we can isolate what type of neuropathy they have.
How would you use the Scrambler therapy if they've got CRPS in multiple limbs?
What we do is we try and through the consultation and through experimenting, obviously, with the placement of the leads, we try and find the initial cause. Usually that's an injury. And when we find the initial cause, we focus on that. Many people have come into me, and I've had to go through 3 or 4 different placements until I find the right neural pathway that calms the nerves down. So it's a matter of using my experience to find the proper nerve pathways to affect the change within the symptoms of the CRPS.
Does the person who's having the Calmare therapy need to stop any of their medications in order to have the therapy?
The only medications that we've come to believe are a detriment to the treatment is any of the anticonvulsants. You have gabapentin, Neurontin, Cymbalta, Lyrica, things like that, or any antidepressants. It's been a general consensus within the providers that those types of medications affect the pain center of the brain in a way that makes it a little bit more difficult for us to communicate with it. It fogs the brain, basically. So any other medications are fine. People have come in and everything from oxys to methadone, things like that. Those are no problem. It's just the anticonvulsants and the antidepressants that we feel inhibit the ability for us to get through to the brain.
And following on from that question, how long before the treatment would you need to stop those medications?
My general consensus from some of the doctors that I've spoken to, it's about 72 hours.
Is there a period of time after you've had CRPS that it won't be helpful?
I'm sorry, I don't understand that question.
So is there a period of time, if I've had CRPS for 20 years, is Scrambler still going to be helpful?
Oh, yes, certainly it can be. I've had people that have had it for 30 years that have had success. But in understanding that, the issues that long-term CRPS patients have are they've done everything. They've done all the medications, nerve blocks, nerve resections, spinal cord stimulators, ketamine. They've done so much, and a lot of that is cumulative, and I think it does affect how long. In some cases, it may take, as with Adam, it took 14 visits with him. Now, I don't understand why in his particular case, but my general principle is that if you come in and your pain level is, let's say, a 7 or an 8, and after 10 days, you're down to a 3, but we're seeing progress each day, then I recommend that you continue treating. I've had patients, not very many, but I've had patients that have had up to 20 to 25 visits in order to achieve full remission of the pain. But the general response happens within the 10 days that we see over the years.
And of course, one of the big questions, what's the cost?
The cost in the U.S. is, in my office, is $3,850 for everything. That's consultation, exam, and the 10 treatments. Now, what I do, which I think I'm one of the few that does this, I allow a patient to come in and treat for 4 visits. And what I'm doing there is I'm kind of trying to make sure that this is going to be effective for them. And I need at least 4 visits to determine that effectiveness, meaning that, as I said earlier, I may have to change the protocol or the placement of the leads in order to get the proper nerve pathway. As with any pain condition, it isn't always the location that is where the pain is emanating from. We've all heard of the term referred pain. So it's imperative for me to be able to have some time to elicit a proper response based on the different nerve pathways. So I allow people to come just do a 4 treatment protocol with the intention, obviously, of continuing on and finishing up the 10. But if they would like, they can only come, they can do the 4. I'd say 95% of people that do the 4 treatments continue and do the 10.
One of the biggest questions we also get is about the difference between Calmare and TENS machines. As we know, 10 years ago, Dr. Cooney, it was, oh, well, it's a glorified TENS machine. Can you explain the difference?
Okay. TENS machine, or any of the physical therapy type machines, you have TENS, you have high volt, low volt, galvanic, Russian stim, interferential. They're all electronic machines that have the difference in them is that they have different functions. They may be trying to relax a muscle. They may be trying to exercise a muscle. They may be trying to move fluid through an area. But in all of those instances, they're treating on the pain with one particular electronic signal. Calmare uses 16 different algorithms and the algorithms are set to send, a no pain signal to the brain through the C cells. And the 16 algorithms are never repeated. And what we're doing is we're treating outside of the pain areas and trying to communicate through the pain into the brain. So we're not treating on the pain. The most important part of it is that the sequence of the algorithms is never repeated. In other words, it's 1 through 16, and then every odd, it's infinite the amount of combinations that can be done. And the importance of that is that it doesn't allow the brain to accommodate to the treatment. And in this way, we can constantly send a no pain signal to the brain in a different way so that we're attacking each nerve pathway to lessen that loop within the brain. And it was interesting because a few years later, after we started introducing the Calmare, I know that there was a claim that it was no more than a TENS machine, and then it was I think about 10 years ago, maybe a little bit more. The U.S. Patent Office gave it a patent. And if anybody's familiar with patents, you know that the U.S. Patent Office will not give you a patent if there's anything else like it on the market. So that, I think, distinguished it from a TENS machine. Okay.
Perfect. Lisa, I think you've got a similar kind of question.
Yes, somebody asked, what's the difference between vector and Calmare therapy?
A vector is more, I think, it's more geared to, I'm not 100% on it, but I'm pretty sure that vector is aimed more at increasing blood flow to an area, which is, it's helpful with certain conditions. I don't think that blood flow is necessarily an issue with CRPS patients. Obviously, it certainly could be helpful with a diabetic patient or someone like that.
There's another question regarding, can I still have Calmare therapy if I have a spinal cord stimulator?
Yes, I do treat people with spinal cord stimulators, but they have to be turned off. And I've treated tons of patients with spinal cord stimulators, uh, many of which have them turned off anyway. But some people come in and do have active ones that have to be turned off during the treatment.
Alex, have you got any more?
No, that's it on the list that I've picked up.
Okay, I've picked up some more. One person said that something that they've looked at, but they are concerned about the weaning off on average. Obviously, you can't, it will vary. But how often does the 10-day treatment need to be redone? Is it annually, less, more, or not at all?
Oh, well, as I said earlier,
This
no,
one's
I
already
don't
been
treat-
answered.
I know,
I'm
but
sorry?
they've asked it again.
I was going to say this one's already been answered. Go on.
Yeah, they've asked it again.
Okay.
Another one has come up is about the people buying their own machinery that we would advise against, but I just obviously want to hear.
No, you have to be a physician to buy a machine. At
Following
least in the
on from that
US,
question,
I don't know what the laws in Europe are, and I don't even know if they would sell to anybody but a physician in Europe.
how do you know that the person that you find that's offering this treatment is legitimate?
Yeah.
Well, I mean, you have to do your investigation. You have to look online, ask, and then question the office as how much experience they've had, what conditions they've treated. Are they certified? Are they part of a group? Are they part of an individual practice? What conditions are they successful with? You have to investigate them. I can't I myself do training. So like someone like a Marcus Fluth in Germany, I recommend him highly because I trained him, and I think that he's the type of doctor that will look into and perfect the treatment as best he can. So there's in the U.S., interestingly enough, there's more and more hospitals. I just was informed yesterday that I think it's the University of San Francisco Medical Hospital. They're starting to use it, and some of the top hospitals in the U.S. That are using it, Mayo and Hopkins, Walter Reed, Massey Cancer Institute, the top cancer hospital, MD Anderson in Houston, Texas, is using the machine. So it's gaining momentum significantly from when I started. And there were only two of us in the country that did it, but now it's gained momentum, and we're hoping that eventually insurance companies will jump on board. But that's been a slow, arduous journey with insurance companies. So
I think one of the most asked question, which we kind of need to answer, I suppose, is where in the world it's available. For those in the UK, sadly, it's not available here.
The closest to us would be Ireland, but a lot of people are going over. There's Germany, Rome. There's various places that you can access the treatment. It's not available in England, Scotland, Wales. No.
Right.
I believe Australia, it's also available. That's another one as well.
Yes. Yeah, there are a couple of people in Australia that do it. Yeah.
And in answer to that question, it's the NHS that's preventing that. And yeah.
Unfortunately, the NHS have to do their own research on any treatments here in the UK before they'll put it on as a treatment option. I believe there is a movement to try and get it over here. However, I think it's right at the very start.
Yeah. Well, I mean, it's interesting when I started doing it. And it really hasn't changed, to be honest with you. When I started doing it, there was, and still to this day, there are only a few insurance companies that will cover it. Now, it's interesting because Medicare is the big coverage for a lot of the elderly here in the United States, and I get a number of elderly patients, and it's ironic in that you have all of the military branches here in the United States, the Army, Navy, Air Force, they all have machines. They do this. The Veterans Administration does this. Like I said, Walter Reed does this. This is being done by the government. And yet the government insurance, which is Medicare, does not pay for it. So there's a lack of common sense sometimes when it comes to these things with the insurance companies. But we have seen some changes. There are west in the United States, there are a couple of insurance companies that are starting to pay for it. I just heard from a colleague yesterday that the GHI insurance in the United States is covering it. I guess my point is that if someone got a machine over there, a physician could charge cash, and people would have to pay out of pocket. But and that's what most people do here. So, any other questions?
There's a lady who's got CRPS in her face, I believe. Can this therapy help with things like headaches and nerve pain in the face?
Yes, it can. We have to again determine the nerve pathways. A number of cases that I've had with people with the pain in the face actually come from the trigeminal nerve, from the TMJ joint, or it could, with headaches, could be suboccipital. I'm treating a woman right now, actually, with that particular condition, who has headaches and neck pain. So, and she's doing very well. So, yes, it can treat those conditions.
Did you train the person in Rome? And if so, would you recommend treatment in Rome? I know you
No, I have not. I have not treated anybody in Rome, and I'm not familiar with them.
Have you trained anyone? Have you trained any providers
in Rome?
Yeah.
No. Oh, I've treated lots of providers, but no one in Rome. I've treated people doctor in India, doctor, obviously, Marcus Fluth in Germany, doctor in Los Angeles, doctor in Chicago. I've treated a number of doctors. Trained a number of doctors.
Thanks. I believe another question on research. There is some research, I believe, isn't there, into scrambler therapy?
Oh, yeah.
Have you been involved in any research?
No. Actually, it's a funny story in that there's a lot of research that's been done at Mayo and Hopkins, and I'm friendly actually with Dr. Smith at Hopkins that does the treatment there. And at one point, I had told him I wanted to do a study, and he started laughing at me actually, because he said, "How are you going to do a study? I have a full staff at this hospital, and it's difficult for me to do a study." He said, "You have to have, in order to do a viable study, you have to have a real machine and what's called the sham machine or fake machine. You need a statistician. You need to know exactly what medications that people have been on, and it's an extremely involved project to get involved with. So he basically showed me the light and made me realize that as an individual practitioner, I'm not set up to do any real good study, but it is being done. Like I said, there are studies being done at a number of the hospitals, and studies that have been done and completed. I think the New England Journal of Medicine actually put out some of that information. I think you can research it that way, or you can go on the U.S. government site, and that has a listing of the studies.
In fact, on that note, Stephanie has kindly put some of the research links in the chat for people if they're wanting to look up that research. Stephanie has she is working with Dr. Cooney, and she's put some of those links in the chat for you.
Great.
Thank you, Stephanie. I think there is one lady that has asked a couple of times, does anyone know if this treatment, do you know, Dr. Cooney, if this treatment has worked for CRPS caused by SSRI medication? She said it would make sense from what you said at the beginning regarding neurochemical.
Well, it usually is. That's an unusual cause, and I would have to really discuss the onset of the CRPS and try and see or correlate between if there was a medication or if there was an injury. So that would have to be determined on an individual basis. Again, that's why I speak to every patient. No patient comes in here unless I have spoken to them personally and discussed all of the implications within their condition and how it has presented to them.
Has anyone got any questions specifically for Nikki? She is the parent of Adam, who has had the CRPS treatment, the Scrambler treatment, sorry. Has anyone got any questions, maybe as a parent, specifically to Nikki?
One's come to me. Nikki, would you recommend it as a parent? Obviously knowing what CRPS is like and then not knowing whether the treatment's going to work, would you recommend it?
Absolutely. I mean, it was definitely an investment for me, undisputedly, but completely worth it. I mean, my son wasn't at school, he wasn't seeing his friends. I had mentioned previously that he's had other pain conditions. You know, he's been prescribed oxy in the past with little effect. Gabapentin wasn't working for him, and I'm sure many of you know how hard gabapentin can be on you as well, even if it is working. So for him to be pain-free, for him to be drug-free, and it to be non-invasive, I mean, for me, it was absolutely worth the risk and seeing whether it was going to work. And as Dr. Cooney said too, you know, within 4 sessions, if it wasn't in fact working for him, I guess I could have also opted to stop the process then. So in my mind, it was a fairly low risk investment. Now, I'm very, very sorry. I actually have another meeting, but if there are any other further questions, please feel free to forward them to me, and I can provide an answer maybe over the weekend and get back to people.
Thank you, Nikki.
Thank you so much, Nikki.
Thanks very much, everyone. Take care.
Take care.
Bye-bye.
Has anybody got any other questions for Dr. Cooney?
Feel free to unmute yourself if you want to ask those questions yourselves. Stephanie has put the contact details for Dr. Cooney's clinic if anybody needs to contact or wants to contact him regarding consultation, etc. Please feel free to do so. I also know that Rachel is in the chat, and Rachel has been to Marcus South, never know how to pronounce his last name, in Germany. So if people want access to those details, I'm sure Rachel's happy to give you those as well.
Great. Thank you.
Please feel free to unmute or put up your hand if you have any questions. It's hi, Len's HP.
That's Len, and I'm Patty.
Hi, Len and
hello,
Patty.
How are you?
We're good. What's your question?
And I have CRPS. I was diagnosed in 2012. And then I've just recently also been diagnosed with FND, functional neurological disorder. I have gone through a really huge journey with CRPS after a total knee replacement. And Dr. Cooney was my lifesaver, basically. I was on a lot of meds that should not be, you know, like oxy and all that sort of thing, and morphine and stuff like that. And it was just really, really bad. I couldn't walk. I couldn't be touched at all. And I was a school teacher, and, you know, and I reached out to Dr. Cooney, and we were just so lucky that he treated me. And where in Australia, everyone was like, the Americans will sell you anything. You're going to be ripped off it. Excuse me, you want to put a spinal cord stimulator in me? That's $50,000. The worst thing that I can get out of seeing Dr. Cooney in a non-invasive, non-surgery procedure is a nice holiday, and I go and see a Broadway show. But you know what? The fatigue, like someone said, after you have Calmare, yes, but when I went to see Dr. Cooney and my pain levels, I had flown 27 hours from Perth, Western Australia, all the way to America, and in economy. It was the
first slept all night.
It was the
years.
It was the first time that when I had the treatment with Dr. Cooney, I actually slept in an Airbnb. Airbnb just had started in this apartment in New York, and I slept like I had never slept before. And I woke up and I was like, oh my gosh, I can actually, there's no pain. I was, you know, because I got to the point where I was thinking of quality of life and not quantity. And my husband was like, no, I'm going to find something. I'm going to find something. And, you know, oddly enough, and I see that a lot of people here are writing about the UK, and I've just come back from the UK, and about that there's no treatment there. Let me explain something about Australia. You know, we're down under. We're right down under, okay? And all our doctors, and I had the best pain specialists in the country looking at me and saying to me, you know, no, they're going to just sell you anything. It's not real. It's not true. And I went and saw Dr. Cooney, and I was struggling. My pain. I didn't come off all the gabapentin. I slowly tapered it off because, you know, it has to be tapered off. But he was aware that I was still on a little bit on it because I was on high doses of it. And even to get through the flight and, you know, everything. So it was, you know, but after my treatment, and I fell asleep, and I like my pain level went from out of this world, thinking of, you know, leaving this world, basically, honestly, to I have no pain. And guess what, Len? Your credit card is going to do damage on 9 floors on Macy's, right? was an amazing feeling. I was walking, he could touch me. I was like, wow. And then I thought, okay, so what are we going to do? You know, and I was coming, as you know, Dr. Cooney, to get booster treatment once a year, you know. And in Australia, I'm sourcing these guys out saying, hey guys, have you heard of Calmare? No,
You're on TV,
yeah. And you know what I did? You know what I did? And I think this is something that maybe the people in the UK or in England, I thought, you know what? I'm going to let people know. I'm going to let them know in this country, we are a first world country where we have Medicare, we have, you know, the best of the best, you know, blah, 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 you know, lifestyle data, and what? We don't have a scrambler therapy anywhere in this country. So I thought, you know what? I'm going to ring the news, the TV, and I'm going to tell them, I'm going to show them I was taking 75 medication a day just to keep everything. I had everything from allodynia to my toenails falling off to burning pain that, you know, we had a makeshift bed like a tent around me. Okay. It was horrible. I lost my hair. I had black long hair. I lost my job. I was a teacher. My children, everything was just, you know, and I thought, no, I'm going to, and Dr. Cooney, I was just so blessed. I did go and speak to the guy that invented the machine in Rome. The only problem, and I've been reading these things in Rome, is that he does it in the hospital. So unless you speak very good Italian, okay,
Right.
and you have to stay in the hospital. Okay, that
was in 2012.
and that's what he does. Okay, he prefers it in the hospital. But with Dr. Cooney, how, you know, the care and understanding, but his knowledge, and, you know, and I thought, Stuffer, I'm going back to Perth. I think we're in the top 5 isolated cities in the world. First 2 years of COVID, we had 9 deaths. Okay, so that's how isolated we are. So I just rang up the news channel and I just went, right, I've got a story here. And I thought that they would give me some time to prep myself, like at least put some makeup on, or, you know, ready, or put an outfit on. No, 5 minutes, 10 minutes later, they're at my front door knocking with a cameraman and blah, 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 going, okay, lady, tell your story. And I'm like, is the makeup artist here? But you know what? I said to them, this is my story. And we explained about CRPS.
Yeah, so the attention basically got more people in Australia interested, which ended up raising awareness, and eventually doctors here took it on board, and now.
Yeah, I actually got people. One lady she found me on Facebook and said, the night that you were on TV, and I was like, you know, she said, I was at that point in my life that, you know, that I was going to give up. I was going to give up, and I saw you, and then she's like, who's Dr. Cooney? And I'm like, I'm going to tell you, this is what you need to do. This is what blah, blah, blah. And you know what? And oddly enough, the doctor that actually said to me, and I'm hand on heart, 2012, he said to me, Patty, the Americans will sell you anything. Guess what? You know what's funny about that? He actually has a clinic with a Calmare machine.
That's really bad.
He's actually converted. So to get that message out, sometimes you do have to be extreme. Sometimes you do. I was absolutely shocked when you know, because this thing on the news was actually on the news feed, so nationally on TV, and that and how many hits it got because of the pain and everything. But the thing is, what I'm saying is sometimes we have to throw ourselves out there to be heard. And I just thought, no, we got to do something about this here in Australia. And guess what? We now have it in Sydney. We have it in Victoria, in Melbourne. We have it in Perth. But it is like, you have to expose yourself to that. Now, my question to Dr. Cooney, because I am so humbled, I'm with Dr. Cooney right now. Hello,
Patty,
you are my...
Oh, it's great to hear from you, really. Thank you.
My favorite person. Between George and you know I choose you, okay? I have been recently diagnosed with functional neurological disorder, which my neurologist said to me, you know what, you're such a special person. And I'm like, Tony, I don't want to be special anymore. Leave me alone. So my question to you, Dr. Cooney, have you come across anyone with CRPS and functional neurological disorder, FND?
Well, to be honest with you, Patty, functional neurological disorder is like it's like the term idiopathic. And basically, it's not really telling you what it is. The important thing is to I'd have to know what the symptoms were, what the presentation is, to give you an idea. Because as I said earlier, in many instances, people will have CRPS, but some doctors are not familiar with that particular diagnosis. So they'll just say it's idiopathic neuropathy, or it's amplified pain syndrome, or functional neurological. I'm not, I can't really address it without, and we can set up a time if you want to talk about it, and I'll go over it with you if you want to do that.
Yeah, definitely. But for anyone out there, like I said, you know, we're in Australia, and no one believed me, and no one understood. You know, I had the top pain specialists in this country, and you know, because my father was in politics and stuff like that, so you know, I had the best of the best, and they just would not even look. And now Calmare is in Australia. When we throw ourselves out there in the community and say, yes, you don't have to be on these drugs, you don't have to, you know, go through this alone. There is support, there is help. And you know, I really appreciate that Dr. Cooney is working hard and looking after us, and you know, and you know that, you know, so I really appreciate it, and I wish you all the best. And
thank you, Patty. Patty, just one question. Years ago, they started, I don't know if you remember Michelle, I think in Australia, they started the Purple Bucket Foundation. I'm sorry?
Yeah.
Michelle, yes, I recommended her to see you, the lady in the wheelchair, the dancer.
Right. And she sent me video of her doing cartwheels on the beach. So she was doing well, and she started the Purple Bucket Foundation.
That's right, there. She did.
And I don't know if that's still viable. I think the Purple Bucket
is still going to this day. They have at Penrith Hospital in Sydney. One of the doctors there, a pain specialist, an anaesthetist, he actually sent his daughter, who's an anaesthetist, to Rome to be trained with the Italian guy, and they've set it up in a public hospital in Sydney. So Melbourne, here in Perth, it's under a physiotherapist with LifeWorks in Subiaco. If there's people here online that don't know where Calmare is, it is here in Perth. At LifeWorks in Subiaco. I don't know how much they charge. I'm not sure, but you know, and also in Melbourne. So, you know, I can see like with the UK people that, yes, it's difficult to travel to go to Ireland or to go to these places, but if you can get the media involved, it's amazing.
It might encourage the right doctor to take it on board.
Yeah, it might shake things up a bit. So, but thank you for listening, and it's been very interesting.
Thank you, Patty. Great to hear from you. I'm glad things are going well. Call me though, or message me, and we'll talk about this functional neurology.
We will say hi to Barbara and the girls for us.
I will. Thank you.
And that'll be an interesting conversation.
Might have lost Patty.
No, that'll be an interesting conversation because we're actually coming across far more people with CRPS and this FND
Right.
at the moment.
Yep. And there are connections because I've actually read scientific papers regarding FND and CRPS. There are connections with it. And unfortunately,
it could be just an offshoot of the symptoms that are presented that we look for through the Budapest test. This could be just
overlap,
the way it shows, So.
Yeah, so, you know, I would like, you know, like I say to all my specialists, and I am very grateful. I do have a multidisciplinary team at the moment. So at the moment, I have a pain specialist, I have a neurologist, I have a physiotherapist, I have an OT. It is a really, and then, you know, it's the Scrambler Therapy, and it is work every day to get better every day. It is a tough job, but we see you, we hear you, you can get out there and do it. And, you know, if anyone from Australia is on board here and they have no idea where Calmare is, I am more than happy to help them and support them in any way. But Dr. Cooney, I spent many years in that room and nearly having the best sleeps while you're doing the treatment. It was just amazing. So hats off to you that you've still helping people and doing this for them. So thank you so much. But we will touch base with you because we found that with CRPS, a lot of other people are getting things like, because I'm part of a CRPS Australia Facebook group, and there's a lot of people that are getting other things like POTS, FND.
Right.
EDS. There's a list of comorbidities. Yes.
So we need to look at that as well. But thank you very much for listening.
Thank you, Patty.
Can I just throw it to Rachel Murray? You've got your hand up.
Hi, I just really first of all wanted to say thank you to Michael Cooney for coming on here and helping, you know, spread the word in the UK. Some of you may know I'm very passionate about this treatment. We were fortunate enough to go over to see Marcus Soof in Germany. He just finished his training with you, Michael, spoke very highly of you. And I've just dragged my 13-year-old moody child in because I just wanted to bring a little bit of hope, because I know everybody with this dreadful condition, it can make you feel really low and very isolated. Phoebe was bedbound. She was unable to weight bear in her left leg. It was swollen. It was purple. We called it dead man's leg walking because it was so black. She had been off school for 6 months. We flew out to Germany. We had to load her up. She had to take diazepam to actually get her on the flight because she had been weaned off all her other pain medication. We got out to Germany, and you don't mind me saying, she was at her lowest of her low, as were myself and my husband. Within the 10 days of treatment with Marcus, we got our daughter back. She came back to England walking. She was on crutches for a few months, weren't you, where she built up all the lost muscles. We've had 9 months of remission. where she has stayed off all her medication. She returned full-time to school. You were playing football, skateboarding and drumming, weren't you? She's slightly come out of remission just in her foot at the moment, but we've contacted Marcus again. He's absolutely great. We've now got a plan in process moving forward. And somebody asked Nikki and said, you know, would you recommend trying this? I'm no expert. I just know what we've experienced as our family. I appreciate every single person responds differently. Our only ethos was we would rather have sat in our lounge in 6 months' time and gone, oh, at least we tried, rather than be sitting in 6 months' time and your mental health was not in a good place and we wouldn't have been anywhere. We'd probably been selling our house and moving to a bungalow and me giving up work. So I just wanted to say, if in doubt, if anybody wants to reach out to me, please do. But thank you to Michael and to Victoria and Lisa for all their support, getting the word out. That's all I wanted to say, really. So thank you.
Thank you for your input. That was great.
Thank you, Rachel. I really do appreciate it. And to Phoebe as well. Phoebe, if it's all right with your mum, do you want to say anything? Do you want to say how it felt or what it was like or whatever you'd like to say?
The treatment itself didn't hurt at all. It just literally felt like almost very light vibration on your skin, and it didn't hurt. It doesn't like feel as if there's needles in it, as I know there's no needles involved, and I don't like needles myself, so I'm very happy that now out I didn't have to have any drips, which was nice. And I don't really know what to say. It was just quite it's just quite nice to have my life back, really, because like my mum said, I really wasn't happy. My friends, they could tell I wasn't in a good place, and now this time they understand more and they've been texting me, making sure I'm okay. They all like spread the word, and all my school have been really supportive of me. So yeah.
And I think spreading the word as well. Her school have now been all educated in it. All the members of staff are aware. And, you know, if anybody on here has got children with this condition, I think unfortunately, it's our job to educate others, isn't it? And so, you know, I went to school as one of those parents and I'm a teacher myself, so I sort of rolled my eyes inward. But, you know, I took loads of literature that I'd printed from Burning Nights. We took photos to show them, you know, this is what happens to the limb that's affected. And the support actually wants people, we still, you know, don't get me wrong, we still get, oh, hope you feel better tomorrow comments. But people are getting better at understanding. So we're just spreading the word, really, aren't we?
Thank you to
Thank
both
you.
of you.
Thank you.
Thanks, Phoebe.
I think we're all questioned out.
I was going to say, is there any last questions for Dr. Cooney before we finish?
There's also his contact details that Stephanie has put in the chat. So if people do want to reach out and contact him, please do so. Yeah. And if you want to read more about Phoebe's story, we've got the article on our website.
Oh, great. Thank you. Any other questions?
Any last questions? Your last chance for Dr. Cooney.
No, there's just lots of thank yous. Thank you for sharing.
My
thank
pleasure.
You for answering.
We got to get the word out. Yeah,
we do. We've got to get it to the UK.
That's right. That's right. So if anyone, I'll say this: if anyone has a physician that is mildly interested, please give them my name. I'd be more than happy to discuss it with them and maybe give them a little prod to get it moving within the UK. So I'm available for that too.
Great, thank you. I think that's all from us. But
I do just want to clarify, we will be sending the recording out to everybody that's signed up. So in case you've missed the beginning or you've missed the end, do not worry, we are sending the recording out.
Thank you.
And just really a thank you from us on behalf of the charity for you taking up the time, your precious time, and obviously to Stephanie as well for helping with it. So thank you, Dr. Cooney. Really appreciate it.
I appreciate your effort in making the condition known and getting the information out to help them. So
no worries.
Thank you. Okay.
No worries. So thank you very much, everyone. And thank you, Dr. Cooney, last one. But yeah, that will be it for today. So thank you, and hopefully see you next time.